My name is Jim Singleton. I'm about 5 weeks short of 83 years of age, and I've been a patient at the Oasis of Healing in Mesa, Arizona since, April or May, I think it was late April of 2007. I've had 3 lives at the Oasis of Healing, and I'm now on my 3rd course of treatment. My first course of treatment, however, is of interest. Earlier in 2007, I had been diagnosed with cardiovascular disease, classical symptoms of pressure in the chest upon exertion, edema in the extremities, and difficulty in breathing after exertion. I'm a member of an HMO and went to my primary care physician, and he referred me to a well-attested cardiologist at a specialized clinic for heart care in Scottsdale, Arizona, near where I live, in a retirement center. And I went to him for diagnosis and for treatment. He confirmed the diagnosis of cardiovascular disease after a series of diagnostic tests, including a stress test where you exercise to exhaustion, and then an angiogram of the heart itself. The bloodstream is dyed, and you go into a capsule for radiation photography, and the heart muscle is photographed, and then the performance of the heart muscle itself is diagnosed by analysis. And he confirmed heart disease, atherosclerosis, he called it, a condition of stenosis, and prescribed medications for its treatment, blood pressure medications called statins, and 1 or 2 others. And so I immediately initiated that course of medical treatment and continued for 3 months, after which I went back for a return visit, and the cardiologist repeated the tests that he had performed earlier and reported to me that the condition was stabilized. Well, that did not sound encouraging to me. On the one hand, it had not gotten worse, but on the other hand, neither had I been treated for anything that would reverse the condition. And as most of us, when we are diagnosed with a condition, would like that condition to be reversed and eliminated rather than simply called stable. And it finally permeated through my thick skull that the cardiologist was not concerned about reversing the condition. He did nothing along that line. He was simply waiting for it to get worse so that he could perform surgery. In fact, he did perform an exploratory angiogram, which threaded a catheter through my bloodstream, the arterial bloodstream, and then permitted him to get up close inspection of the heart muscle performance. Normally he would have inserted stents in my blood vessels at that point, but his assistant later told me that apparently in engineering terms, the location of the greatest impediment in the blood flow did not permit a stent to be installed. So I escaped that provision to my great relief, and was continued on a medical course of treatment. I have a computer, and with today's plethora of websites on medical subjects, I was able to look up the condition of atherosclerosis and study the availability of treatments, looking for some condition that would eliminate the cause, the impediments in the bloodstream and the inflammation to the bloodstream, which were its primal causes. And ran across the use of the word chelation, which I had not been familiar with previously. I have since learned that that is derived from the Greek word claw, and what it refers to is that there are heavy metals in the bloodstream, heavy metal ions, which the blood never excretes. The body will not, once a heavy metal ion has been introduced, mercury or nickel or cadmium or any of them, it stays in the bloodstream or in the body throughout one's lifetime. And the characteristic of heavy metal ions is that they are a major contributor to the generation of free radicals in the body, which damage the mitochondria of the blood vessels and diminish the effectiveness of the immune system. Hence, the damage that it performs in the blood vessels themselves. The impediments to the blood vessels are built up from irritants that flow through the blood, and heavy metal ions will contribute to that inflammation and the damage, lesions to the endometrium, the lining of the blood vessel itself, leading to the buildup of plaque and calcium and the generation of the clot in the blood vessel itself. Chelation eliminates those heavy metal ions and returns the blood vessels to their original, intended, natural, supple condition, free for blood flow and nothing else. The use of chelation, however, due to a circumstance which I studied in quite a lot of detail, was a governmental nightmare caused by the lack of freedom for providers to advertise the availability of chelation to reverse cardiovascular disease. Apparently, the Food and Drug Administration approved the use of a weak acid in chelation, in infusions, intravenous infusions, to eliminate the toxins of lead poisoning, which, as many of you will know, were a constituent in paints, house paints, in the 1950s. And kids chewing on paint chips would get blood poisoning from the lead that was contained in that paint. FDA approved a weak acid called EDTA, and that acronym stands for ethylene diamine tetraacetic acid, EDTA. And it is still prescribed and advertised for the relief and solution to lead poisoning. Incidentally, however, it also automatically eliminates all other heavy metal ions that contribute to cardiovascular disease. And the widespread use of EDT chelation as the cure for treatment of cardiovascular disease would threaten, and does threaten, a $300+ billion annual income to conventional cardiologists who abjure EDTA in preference to expensive surgeries. And the The governmental nightmare is that health insurance compensates patients for the use of customary and usual, quote, close quote, treatments for disease conditions. Surgery, coronary artery bypass grafts, running at the average of $80,000 per treatment, per procedure. Angiography, which involves the installation of stents, and the rest of the conventional medical treatment for cardiovascular disease are customary and usual. Therefore, all forms of health insurance, from Medicare to private insurance, reimburse the patient expense. They do not reimburse the expense for an $8,000 yearly treatment of EDTA infusion, which completely reverses the condition of cardiovascular disease. Now, there's an anomaly, and it's criminal. I had the treatment, however, because I was in the fortunate position to be able to afford it, and found a provider that enabled me to do so, that provider being the Oasis of Healing, alternative medicine, Oasis, and it is aptly named, which provided that treatment for me, and within a year I was free of all evidence of cardiovascular disease, from pressure in the chest, from shortness of breath upon exertion, from edema in the extremities, and as an incidental bonus, the elimination of age spots from the backs of my hands. That came free. And I have nothing but praise for the Oasis of Healing, and have maintained a patient relationship over the years, over the last 3 years, to a point where now I am being treated with human growth hormone for the rejuvenation of age-related infirmities, and have increased muscle mass, have increased energy levels. I never lack for energy during the day. My schedule is much less demanding than it was 60 years ago, but so many of my peers at the retirement center I live in complain of being constantly fatigued, not having the energy to get up and do what they are accustomed to doing and want to do. The mental changes have been equally dramatic, if not more so. My mental acuity, my memory capacity, my recollection of events, my ability to maintain a consecutive line of reasoning for an extended period of time goes on undiminished, and reminds me of how I felt when I was 55 years old, and I'm 5 weeks short of 83. Thank you.